Today I wanted to talk to everybody about a condition that I see in the office almost every single day. It's called plantar fasciitis. This is a condition of extreme pain in the heel, especially when people take their first steps out of bed in the morning. The ligament that supports the arch of the foot is called the plantar fascia. When that ligament is strained or torn out of the insertion into the heel bone, it causes an inflammation and damaged tissue, which leads to severe pain on walking. What we do in the office is try to treat this condition and to restore patients' normal walking through various methods. The heel bone has the insertion of the plantar fascia, which runs from the bone up to the ball of the foot. So we want to control the foot so it does not collapse and flatten the arch, which tears the plantar fascia. Many people will suffer from this condition due to a variety of different reasons. People who are overweight, people who spend too much time on their feet, people with changes in their occupation or their lifestyle where they're putting increased time and activity on their feet when they've not been used to that. People who wear improper shoes with improper support also frequently develop this condition. It happens also a lot in the summertime when people start to walk barefoot or wear flip-flops where there is absolutely no support for the foot and the arch of the person's foot. When someone comes into the office with this heel pain, I want to try and give them as much relief on their first visit as possible. We will thoroughly examine the foot, determine what the causes are from examination of the biomechanical structure of the foot joint motions and structure, as well as from an x-ray of their foot. Once I've determined all of the causes, we can come up with a definitive treatment. But again, on the first visit, the goal is to make someone feel better. Treatment on the first visit often involves the application of a foot strapping to reduce the stress on the arch ligament. We'll apply one of various different pads to the bottom of the foot to support the arch. We will then reinforce that with taping into the arch to hold up the bony structure. By applying this tape strapping, we help to stop the foot from being able to drop and collapse in the morning on the first steps or through the course of the day. As we don't allow the foot to collapse, the strain on the ligament where it's tearing out of the heel is reduced. Once the patient comes back after their first visit, they usually will say that the strapping made a tremendous difference in helping them with their pain. If this is the case, then we know exactly what we want to do next for the patient. We will provide the patient with some written instructions for some exercises to stretch the feet. The first one is to bend the foot all the way up, count to 10, relax the foot, and do that 5 times for 10 seconds each time. The second exercise involves crossing the leg over the opposite leg, bending the foot up, and pulling back on the toes. Again, for a count of 10, 5 repetitions. The stretching should be done to both sides equally.